Youth under the age of 25 are at a higher risk from using cannabis because cannabis can change the way their brain grows and develops. These structural changes can be permanent. The brain continues to grow and develop until about the age of 25 and happens rapidly during the teen years. When cannabis is used at a young age, the THC, which is the active ingredient in cannabis, can change the way the brain is developing, particularly the parts of the brain that are responsible for decision-making, judgment, and problem-solving. When cannabis is used at a young age, there is an increased chance of experiencing psychosis and schizophrenia, especially when someone in your family has or had these conditions, and when cannabis is being used daily or almost daily. Some youth believe the myth that cannabis is not addictive. However, cannabis can be addictive and can lead to both a psychological and a physical dependence. The risk for addiction is 17% when the use of cannabis begins as a teen. Cannabis can be smoked. In this case, the plant material is rolled in paper and lit like a cigarette, called a joint, or it can be smoked using a pipe or bong. Cannabis can be vaped using a vaporizer or vape device that heats the cannabis but does not burn it to release the active chemicals, which is THC and CBD. Using these methods will result in a high felt within seconds to minutes and can last about 6 hours or more. Cannabis can also be ingested in food, drinks, or swallowed in a capsule. The effects are usually felt within 30 minutes to 2 hours and can last up to 12 hours. If someone is unaware of this delayed effect, they could end up consuming too much, which could result in illness or injury. Be prepared. Make sure you know the facts about cannabis and other drugs. You can stay informed by tuning into social media, TV shows, and visiting reputable websites. Find the opportunity to start a conversation. Use a reference from social media, a newspaper article, or a TV show that contains a situation about drugs. Ask them to teach you about cannabis and other drugs that they know about. The Cannabis Talk Kit is available on our Parenting in Ottawa website if you need more information on tips and information on how to talk to your teen. It's sometimes hard to distinguish cannabis use from normal youth behavior. You know your child best, but some signs to watch for include abrupt changes in friends, unable to focus, more tired, less motivated, mood changes, spending more time alone or away from home, a change in school performance. Immediate signs of impairment, like glassy red eyes, avoiding eye contact, and slurred speech. Inappropriate laughter, loss of coordination, more clumsy than normal, increased secrecy about possessions, friends, or activities, the smell of smoke or other unusual smell on breath or clothing, evidence of drug paraphernalia such as pipes, missing valuables, money, or medication. Not using cannabis is the best way to avoid the risks to your health. If your teen is planning to use, help them reflect on why they are using. Talk to them about the lower risk guidelines and follow these tips to help your teen make a responsible choice that considers their mental health, physical health, and safety. Go easy on their lungs. Cannabis smoke has many of the same harmful chemicals as tobacco smoke. Try vaping or edibles instead, but be aware that these have their own risks. Pace themselves, start slow, go slow. Start with a small amount and wait 30 minutes or more to feel the effects. Plan a safe ride home because cannabis impairs the ability to drive safely. We have more tips on our website at www.ottawapublichealth.ca. Ottawa Public Health nurses give presentations about cannabis in both elementary and high schools. Cannabis is also part of the grade 6 health curriculum, and OPH nurses are available to help teachers inform their students on that topic. There are many services available in Ottawa to support youth or parents around substance use. OPH works in collaboration with schools, school boards, and community agencies to promote and support each other's services. For more information, you can go on www.parentinginottawa.ca.